Hey guys, welcome to Med School Made Easy. So today we'll talk about the cranial nerves. So we'll have a look at the types of the cranial nerves, the nuclei, the components and the functions, and openings in the skull, and then the pathways of some of the nerves. So what are the types of cranial nerves? So first we have the olfactory nerve, and then the optic nerve, the oculomotor nerve, the trochlear nerve, the trigeminal nerve, the abducens nerve, the facial nerve, the vestibular cochlear nerve, the glossopharyngeal nerve, the vagus nerve, the accessory nerve, and the hypoglossal nerve. So there is this mnemonic which you can use to memorize these 12 cranial nerves. So now let's have a look at the nuclei of these nerves. So first we have the oculomotor nucleus, which is in the midbrain at the level of the superior colliculus. And then we have the trochlear nucleus, which is also in the midbrain at the level of the inferior colliculus. And then we have the trigeminal nerve, which has several nuclei. So we have the motor nucleus and the sensory nucleus, which are at the level of the upper pons. And then we have the mesencephalic nucleus, which is in the midbrain, and then we have the spinal nucleus, which is extending from the upper pons to the C2 segment of the spinal cord. And then we have the abducens nucleus, which is in the lower pons, and then we have the facial nerve nuclei, which are namely the motor nucleus, the nucleus of tractus solitarius, the superior salivary nucleus, and the lacrimatory nucleus. So all these are situated in the lower pons. And then we have the vestibular cochlear nuclei, where it has where the vestibular cochlear nerve has 2 cochlear nuclei and 4 vestibular nuclei. And these are at the junction of the medulla and the pons. And then we have the glossopharyngeal nucleus. Namely, we have the nucleus ambiguus, the inferior salivatory nucleus, the nucleus tractus solitarius, which are at the medullary level, and then we have the vagus nuclei, which are the nucleus ambiguus, the dorsal tractus solitarius, and the nucleus of the tractus solitarius, which are also at the medullary level. And then we have the spinal part of the accessory nerve, which is extending from the C1 segment to the C5 segment of the spinal cord. And then we have the hypoglossal nucleus, which is also in the medulla. And then now we will have a look at the components and the functions of these nerves. So we have the olfactory nerve, which has the special visceral afferent, and it aids in olfaction. And then we have the optic nerve, which has the special somatic afferent again and aids in vision. And then we have the oculomotor nerve, which has general somatic efferent, general visceral efferent, and the general somatic afferent components. And the functions are movements of the eyeball, the contraction of the pupil and accommodation, and proprioception. And then we have the trochlear nerve, which has the general somatic efferent and the general somatic afferent components, and it helps in the movement of the eyeball and also proprioception. And then we have the trigeminal nerve, which has the branchial efferent and the general somatic afferent components, and the functions are movement of the mandible, proprioception, touch and pressure, pain and temperature of the face. And then we have the abducens nerve, and it has the general somatic efferent and the general somatic afferent components, and it helps in lateral movement of the eyeball as well as proprioception. And then moving on to the facial nerve, we have the branchial efferent, the special visceral afferent, and the general visceral efferent components. And the functions are facial expressions, elevation of the hyoid, taste of the anterior two-thirds of the tongue, and then secretomotor fibers to the submandibular and the sublingual glands, as well as lacrimal gland and nasal and palatal glands, and also proprioception. And then we have the vestibular cochlear nerve, which has a special somatic afferent component, and hearing and balance of the functions. And then we have the glossopharyngeal nerve, which has the branchial efferent, the general visceral efferent, the special visceral afferent, and general visceral afferent and general somatic afferent components. And the functions are elevation of the larynx, and the secretomotor fibers to the parotid gland, taste of the posterior one-third of the tongue, and then sensations from mucous membranes of pharynx. And then we have the vagus and the cranial part of the accessory nerve, which has branchial efferent, general visceral efferent, general visceral afferent, special visceral afferent, and general somatic afferent components. And then the functions are movement of the palate, motor and secretomotor to bronchial tree and gut. And then we have sensation from the viscera and taste from posterior most part of the tongue and the epiglottis, and then sensations from the skin of the external ear as well. And then we have the accessory nerve, where the spinal part has the branchial efferent and the visceral efferent components, and it innervates the sternocleidomastoid and the trapezius muscles. And then we have the hypoglossal nerve, which has general somatic efferent and general somatic afferent components, and it helps in movements of the tongue as well as proprioception. So I'm going to end the first part right here, so we will have a look at the rest of the topic in the next video. So thank you for watching, and I hope you guys found this video useful. So don't forget to subscribe and turn on the post notifications on, so you can get notified